Hello, everyone. Welcome to the session African Roundtable. I'm Abel Entova. I'm going to be your moderator. If you have any questions during the session, you can post them in the Q&A panel on the right side in Whova. The speakers are going to introduce themselves. So I'm going to give the word to Omar Shaker.
Thank you, Abel. Very nice to be here. I'm really excited. My name is Omar Shaker. I am a physician who turned into a clinical data analyst, and I'll tell you a little bit about how I got involved with FHIR. Today, we are excited to kind of start a longer conversation, hopefully, about interoperability in Africa. And our big question today is, will FHIR make time? And I will explain why this is really important today. But first of all, here's our agenda. Oh, you can't see my agenda. This is not what you should be seeing at all. Okay, there we go. So I'm going to give a quick welcome note, explain, kind of set the stage for our speakers, who I'm very proud to have with us today. We have three different perspectives. First will be Dr. El-Tayeb. He is a physician who turned into a CEO of a very important company that's doing a lot in the sense of transforming how payers do claims and do their payments, but also building a lot of products in technology. And then we're going to have Dr. Akpakpan. Sikak has a wide experience in data science. He's also a physician that's worked in many different countries around the world, not just Africa, and is currently leading the global applied intelligence for Accenture. So he has a very global approach and has very strong ideas about how we can do ability. And then finally, Dr. Okogun is the CEO of Lily Hospitals. He's a very forward-thinking guy, really taking strides when it comes to Nigerian healthcare and trying to survive COVID, but at the same time innovating and creating new things. So he's going to give us the provider perspective, and then we're going to open it up for 20 minutes, which is the point of this conversation. So each speaker is going to have 5 minutes to talk, and then we're going to open it up for discussion. So each one of us is going to ask you a question, and before we start telling you what we think, we want to know what you guys, how you guys perceive Africa now. So if we may. If you can just answer this question, like the first question I want to ask you is, will FHIR play a major role in Africa? I'd love to get your feedback on that. So please put it in the chat box, and if you have any ideas or questions related to that. But this is the question we're going to be trying to answer today. So we'd love to get your feedback, and Abel will collect them, and we'll talk about more of your answers in the end. So we hope that this is really an engaging two-way conversation between us and you, because we all have, each one of us has a different perspective, since we're 4 people, but everyone on this call will have a perspective too. So start putting in your answers to these questions that we asked, and all the questions, please let us know. My experience is that I'm a physician. I graduated from Ain Shams University in Cairo and then moved to Tufts Medical Center, thinking that this is going to be the most glorious thing in the world. And I realized that practicing medicine isn't what I thought it was. It looks more like this now. It's a doctor hunched over a laptop or a computer and trying to make sense of what this technology and how it's serving them. My seniors I saw several of them break down because of what they had to do after their work. And I realized, you know what, this is not for me. So I moved to clinical data analytics and spent a lot of time with health information exchanges around the US, helping really big payers solve this problem of clinical data. And even though the US, as all of you know, has incredible amounts of penetration, and EMRs are virtually everywhere now. But I was working on this idea of like, why can't we still get clinical data that works? And why can't we make any sense of all the clinical data that we've been collecting? And I've been helping big payers answer that question. And what I realized is that are, quite frankly, a lot of us as an industry are not looking at the right questions, not looking at the right problems and think that we are solving some big problems in certain ways, but really the value that's coming out isn't that much. And I'm talking about, we were only able to get like 20% of lab results, which are already stored, just because of standardization problems. So I went on my own search for meaning, and that's part of my journey, was figuring out what FHIR is and starting to go to these HL7 conferences and getting engaged with the FHIR team. And during the past year, my story led me back to my hometown in Egypt, in Cairo. And I've been here for the past year, trying to think of what is going on in Africa. Is there a major opportunity for us to change things as they are or not? And I came back very bright-eyed, again, just like I went into medicine, thinking Africa is the answer, Africa is the future. And I had a reality check. And this is my own perspective and my own idea of where things are going. There's a very low % of health information system implementation in general. In Egypt, it's less than 9%. I think South Africa has the highest ones, but South Africa still has a lot of legacy systems. There's data. I've spoken to top executives that are just paranoid about this idea of data in general, even its existence, which I think is going to change. But then there's also high cost of implementation. So African executives see this as an added burden. You tell them that information is the future, they understand it, but then when you come to the cost and the numbers, where is that incentive? Where is that high-tech act that the US had that is going to make me as a hospital CEO go and implement something? And we're going to hear today from Dr. Austin, who's actually decided to build it. And we're still talking about a continent that still sees millions of people get pushed into poverty every year. But there are some bright things. There's conglomerations, universal healthcare coverage, big hospital systems that can make quick decisions. So the question is, and that's what Dr. El-Tayeb is going to be probing into, is like, are we talking to the right stakeholders? Are we really engaging people who make these big decisions? And I think it's going to happen overnight. It's not, even though we're at 9% penetration, it's going to happen in a way that I think is much faster than someone that's outside of an African city, or even us that live in Africa, would be able to understand. So without further ado, I'd love to start introducing my guests. Each one has a different perspective. Like I said, Dr. El-Tayeb comes from they're all physicians, but Dr. El-Tayeb is working with Egypt's largest payers and building technology for them. And he thinks there's no quick fix, right? FHIR needs to engage the right stakeholders and start talking to the right people. So I'll come back to this slide and tell you more about my other two guests, but without further ado, I'd love to introduce Dr. El-Tayeb to give us his perspective on whether FHIR will make it to Africa in time and what he thinks is most important.
Thank you, Omar. First of all, thank you very much. It's a pleasure to be here, and thank you for coming. So just very brief background. Originally, I'm a professor of neurosurgery in Cairo University. I've been working in healthcare since more than 25 years. I still practice neurosurgery in private and public settings. I've worked with the providers on the provider side, both in government and development and private hospitals, both on the financial and administrative side. And then we founded Smart Medical Services, which is e-insurance and digital third-party administrator. The main core of what we do is the technology part. This is our edge. This is where we think is going to happen. This is what we've invested in over the past 10 years. So my first question, which I'd be very intrigued to understand, is who would everyone listening think that, who is the most important stakeholder for interoperability? Who is the most important stakeholder? I've noticed two things. Everyone who's talking, the four speakers, are doctors. So this might direct us in one direction. I'd be very interested to know what everyone thinks is, who is the cornerstone of interoperability? Is it patients or doctors or software engineers, or is it business owners? So, and when we say will FHIR make it on time? So what is that time? When are we expecting something to happen? Where is that benchmark of time in relation to other continents or countries? So one of the most important things I focus is engagement of all stakeholders, because alignment is extremely important and everyone has to have a say. And moving forward to that, this is not being taught to medical students. Doctors and medical staff are a big part of the community. They're a big part of how this is going to be implemented. They're the ones who are going to use it. So I can tell you that I still teach in the university. The physicians haven't, and I think in most of Africa, they're not taught that there is this idea of interoperability. They know there's a problem, but they don't quantify it there, and they don't know there's a solution. Other stakeholders who might not be attending are where investors or donor money or WHO itself. So this is important that there's a big focus on who are the most important stakeholders. That will take us to our next issue, which is it's in Africa, it's about resources. I guess in the entire world, the US spends a lot of money on healthcare, and at the same time, still faces a lot of challenges in terms of equality, in terms of access, in terms of cost, which is going towards value-based care. It's not about how much you spend, it's about what you get back after you spend that money. And resources are going to remain limited in Africa. So this is an important thing, and we have to address it from a financial viability. Any solution we come up with has to have financial viability for high rates of adoption, for sustainability, and for it to actually grow. And this is an incentive which would take us to, so who judges this financial viability? It's a big part of it comes from payers. So payers are either government or private sector or developmental funding organizations. I go back to what Omar was saying about in his remarks about there's low government incentive, a high cost of implementation, and these are major things. These are things which government has a role in and payers have a role in. And when you come to the cost idea, which is high cost of implementation, there are two types of health information which we need to exchange with each other. One of them are the actual health records, what the patient complains of, what the patient has actually. And this would validate the payment information, because providers face the problem of that they have to be paid. At the end, someone has to pay for this service, or they will not provide this service, or they will provide an inadequate service. It's not the most important and only thing, but this is one of the major cornerstones. So going back to the stakeholders, most doctors do not know what ICDs are. They do not know what coding is. They don't know that there is actually a code for everything. These types of information have to be mobile, as my colleague, Dr. Oss, is going to say more about, but this mobility there's a big legal and regulatory framework. Africa is very different than the rest of the world. So the legal and regulatory framework, especially with the data protection laws, they're very individual and they are in the African context and culture. So this is going to be something which we have to be engaging and planning, which goes back to the stakeholders. So it's not just about the health records, it's not just about the technology or the financial viability. It's also about the legal framework which would allow mobility, whether in between providers or between local or regional or even global. And I think this is one of the things which we are facing currently in the country. We have a new, very strong Data Protection Act. So this makes us start thinking. It's more of a complex global problem. It's not a simple problem. It is something which we have to address in a different way. I don't think there would be shortcuts or quick fixes. And the key thing is involving the right stakeholders and then thinking in terms of a more comprehensive solution which has financial viability for whoever is paying, whether it's government and private or developmental organizations. And we have to remember that it's very important that, as Omar was saying, that the government or any payer has to see that, and that has to be in a regulatory framework, which would work in the continent, because it's a different kind of context. So I always go back to the idea of complex problems are solved by time, design thinking, a lot of effort, but this is how we start approaching it, not just through one single solution. So that's how I perceive it, and I'd be very intrigued to see how everyone thinks who is the most important stakeholder. Check the chat box. Thank you, Omar.
Thank you so much, Amr. And Abel, can we get some of the inputs so far?
Yeah, sure. Well, not so much input, but Graham says the great thing about interop is that everyone is a stakeholder at the table. So that's a remark of his.
Okay, and Graham, we love you, but we will challenge you on that when it comes to Africa. Graham, for those of you who don't know, is pretty much the godfather of FHIR. And so it'd be interesting to take, and he's one of the people that wanted to make sure that this actually happens in DevDays. So we're excited to be here and open the discussion. And I think that Africa has its own flavor, and stakeholders actually matter a lot. So I would support Dr. Amr on that. And curious, please, use the chat to let us know more about what you think. I'm only challenging this because it's Graham and he can take it. But we really want to hear your thoughts on these questions. So I'm going to introduce my second guest, Dr. Akpakpan. They worked with extensively during working with health information exchanges and payers, and he's currently the head of Global Applied Intelligence at Accenture. He thinks that we need bold strategic multi-year programs to mature national health systems, and that is the way to do it. So he strongly believes in the role of government, and that we as developers should not be afraid to approach Ministry of Health and these regulators to actually make this happen. So Sikak, I'd love for you to come on camera and let us know what you think.
Can you guys hear me?
Yep, we can hear you, but we can't see you yet.
Okay.
Yeah. Your PowerPoint is sharing, you didn't press play yet, I think.
Okay. Play.
The other one, yeah. Great.
All right, but you still can't see me, right?
Nope, not yet.
All right, let me just continue.
There you are.
Let me just continue with the presentation. Hopefully you can see me. My name is Sikak Akpakpan. If you're Nigerian, you recognize that as a name from the eastern part of Nigeria. I'm from Akpakpan state of Nigeria, but I've been away from Nigeria for over 20 years now, journeying through different countries, Europe for my anesthesiology training, and in the US now working in management consulting, focused mostly in the development sector. So as the Global Applied Intelligence Lead at Accenture Development Partnership, my role is to facilitate and support big data interoperability, advanced analytics, machine learning, intelligent automation, and algorithms in solution delivery in the international development sector. The emphasis is on the fact that we want to use emerging solution architectures to solve problems related to data availability and data analytics to physicians and other stakeholders in the healthcare delivery value chain. So that's about me, but I'll quickly go into my thoughts here. But I think the overall the objective is just to provide my perspective on FHIR in Africa, kind of talk about the different perspectives that and the reasons for those perspectives, and formulate some call to action, challenge us to think about things that we could do to facilitate FHIR in Africa. And so in terms of questions at a very high level, I'm interested in, how many of us work in government, how many of us are involved in strategic planning and developing and participating in national government strategic development and budgeting for healthcare. I'm also really quite interested in, maybe at the end of the talk on, how many agree with the perspective, what are the counter arguments against the perspectives I've offered, and what additional approaches we should pursue to make interoperability a reality in Africa. So that's the thought. Those are the questions. I hope the audience can think about as we go through the conversation. So in terms of what are my perspective on FHIR in Africa, I believe there's limited awareness, and I know Dr. El-Tayeb and Okogun will correct me here, but it's based on my exposure with international development projects, there are very, very few projects that are thinking of implementing FHIR. And there's not much appreciation for why it's important. And the conversations are happening, at the developer level instead of a strategic level, where the impact and the value proposition of FHIR need to be discussed. So because of that, I'm hoping I'm not the only pessimist on the panel, because it doesn't seem that there's much thought about interoperability, just because of the state and the nature of the health systems in Africa. So just thinking in terms of the perspective, the reasons for my perspective, interoperability projects that are going on in Africa, and there are many of them, are not connected to national health strategies, which limits the achievement of the impact that interoperability is supposed to provide. And also, there's health systems are maturing in Africa, and putting interoperability has to be put in context, and it supports the integration of data from multiple sources to analyze and determine where the best practices and where the opportunities are in improving the healthcare delivery of populations. And very few projects, in my opinion, and I might be wrong here, very few health projects are well designed, funded, and governed to support continuous digitalization and interoperability. And I think that's one of the major problems, especially in the international development sector. Most projects are based on grants, and when the grant runs out, that's the end of the project. There's no continuation of some of those health projects beyond the granting period that is available. So just going over some stats, I found this very interesting. There are about 1,000 digital square projects, and that's between 2013 and 2020. And most of them are funded by NGOs. 10% completion rate for all those projects. So most of the projects seeking to achieve interoperability don't get completed. About 100 digital health implementations, 250 implementation vendors. 30% of them are African developers and system integrators. So we have as many as 30 FHIR projects, 600 FHIR resources, 5,000 FHIR profiles in Africa. And most of these are, 10% of them are at government level. If you ask me, I'll say just too many. It seems we are moving away from interoperability with all these resources. 15% of projects are creating reusable assets like APIs. And there's, in very few cases, 5%, country level. There's a mention of country level interoperability resource participation, like, immunization registries and so on and so forth. So, other observations, the value purpose of FHIR is not clear. to healthcare professionals, and I hope Dr. Okogun would prove me wrong there. There's still distrust of medical records because of poor quality, limited demand for aggregate view of health information because planning is still maturing. Resourcing of health and budgeting for healthcare delivery at a national level is still maturing. The reporting requirements are limited, and when those reports are requested, there is no requirement for the reports to be auditable, and we lack legislation and financial incentive, to kind of drive adoption. So those are the observations, and these are the reasons for my pessimistic view of FHIR in Africa, at least for now. And here's what I think we should do. And I think I've attended many FHIR conferences, and there is I think there's a need for us to demand, as developers and enthusiasts of interoperability, demand strategic multi-year programs to mature health systems in Africa. We should pursue leadership positions to advocate both capacity building at a functional and technical level within African countries. And we need to facilitate and participate in communication of value. As Dr. El-Tayeb mentioned, the economic value of interoperability is related to health equity, and we know that the highest predictor of GDP is the health status of the population. And we need to advocate for a new care management paradigm which does not just focus on disease. It takes into account social determinants of health and other determinants of health, and brings the attention to the fact that healthcare, realizing healthcare requires both the integration of health data and non-health data. So data about cultural, economic, environmental, social, all important in building and designing healthcare solutions of the future.
That's a really interesting perspective, Dr. Sikak, and very, very interesting stats about the state of FHIR in Africa. And I would love to, I'm very interested in what Dr. Austin Okogun would have to say about this. So we'll definitely come back. Thank you so much, Dr. Sikak, and we'll be moving to our third perspective, from a provider standpoint. If you have any questions for Dr. Sikak or Dr. Amr before, please do just leave them in the chat again. We can see you now, Dr. Abad. That would be great. And we do want to keep some time to either answer questions and also have our participants actually challenge each other and open the conversation. So Dr. Austin, I know we're squeezing you in time, but I'd ask you to just walk us through the deck quickly so that we can have some of that conversation and to and fro afterwards. So the mic is yours, sir. Dr. Okogun, you're still on mute. We can see your screen, but we can't hear you for some reason.
Okay, that's fine.
Yep.
Okay, sorry about that. I was already talking away, I didn't know. Anyway, I said my name is Austin Okogun. I'm a medical doctor by training, and I'm at the moment the CEO of Leader Hospital Group. In our group of healthcare businesses, I'm also the managing director of the Bravo Health Limited, the health IT software company. Today, I'm talking about FHIR. The question is that will FHIR make it in Africa? Well, my answer is yes. That's what I believe. But I know that for that to happen, there has to be a lot of awareness about FHIR across Africa and the value that it brings, when it comes to information sharing. The reality is that African people are moving just like the rest of the states of the world. Lots of patients are leaving Africa for medical terrorism elsewhere in the world, and therefore there's need for information sharing, because it becomes to a point that just the way we're talking about globalization. I mean, in my perspective, globalization is all about information sharing. And so health information is not an exception, which in the future may be a very important personal asset. What is the state at the moment? It's very low. Most hospitals in Nigeria, in my perspective, about 90% are still manual in their operations. There are different kinds of EMRs available in the country, both local and foreign EMRs. Most of them are local now. A lot of efforts are being made locally to design EMRs. The reason being that most of the foreign EMRs are very expensive and not affordable by the local players. On the other hand, those EMRs automate a different kind of system, which is not in line with our manual operation here. So there's, however, increased uptake of automation. What is slowing it down is affordability. In Lily Hospital, we started thinking about automation many years ago, even before 2012, as in this slides. But however, we've been through many platforms. Internet was one of the ones used at the time. We got it, we overgrew it as our business expanded. We got a group of IT people, outsourced to them to build one for us called MedPro. That didn't stay for too long. We tried to buy one from India called Insta. It still didn't stay for too long. The reason being that the support was very poor because India is far away and our time zones were different. But in 2015, we decided to build our own software. We put a team of developers together as part of our IT unit, who built our first version of our software that we're using at the moment. And currently we're on the third version. Those same group of developers were now placed in a different vehicle called Bravo, because we are looking at commercialization. The reason being that we think that if we can have a good platform, which we can give to other players in the industry at an affordable rate, so that there can be more, that's to encourage automation across our environment. Now, what's the case for FHIR really? Healthcare really is a business that runs on collaboration. Patients are very mobile. They move between healthcare facilities, even with the same location and across borders. So, and even within the healthcare space, there are different kinds of players: primary care, secondary care, tertiary care. There are pharmacies, there are laboratories, and all these players, keep healthcare information in regards to the patients, and there is need for sharing in order to make the care of the patient really more effective. So the future, in my perspective, should be that of a seamless, interconnectivity, among all these various players, so that the patient, the customer, the common customer, the patient, can have this information, move with him wherever he goes, and therefore that can improve the kind of care, save time, everybody's time, and also help to create an audit kind of system. Because if I get data from another hospital, apart from really to know what has happened there, I can also audit and give feedback. Is there an opportunity for FHIR really? Well, I think so. I think at the moment, healthcare generally is fragmented digitally, and FHIR can be the hope to reverse that, the fragmented care. I think also that effective delivery of care, to the patient, we strive better on the back of collaboration, and that can be made possible by FHIR. And that the FHIR standards also holds a very strong potential, for a broad-based digital, healthcare ecosystem globally, which with regards to information sharing. So in summary, I think there's a great need for a meeting point for sharing of information, across various EMRs. I also think the information sharing is the hallmark of the information age where we all live, and that healthcare cannot remain, as fragmented as it is, digitally on the global, in a globalizing world. Those are my contacts, and my concerns at the moment is that I'm wondering what your perspectives are. Do you think that there is need for us to spread information about FHIR across Africa in order to raise the awareness of it, and therefore set expectations as to the value it can bring, to the healthcare delivery system in Africa. I think that we may come to a point that the world evolves when information sharing, becomes, the norm, and unhindered, so that the patient can request their information to go with them. Do you think that's going to happen soon? 5 years, 10 years, 20 years? Well, I think it's going to happen sometime. Thank you very much.
Thank you so much, Dr. Okogun. Very exciting stuff that you're going, and thanks for outlining also where the opportunities are. Fragmentation seems to be a key thing. I hope these three perspectives kind of gave you an idea of where we stand, what's happening in the continent, and then we have 10 more minutes. So if there are specific questions to one of our speakers, just please let us know, Abel. But until then, I want to try a little game here and kind of challenge one of our speakers and invite him to at least reflect back, what he heard from one of the other speakers. My question, I'll start with Dr. El-Tayeb. You spoke a lot about stakeholders and involving really big people in this problem. You are one of the enlightened few right now, right? And it's the reason why I love working with you, because there's always something to learn. You are a knowledge powerhouse in a place that doesn't have that much knowledge, and you are someone that can build software, can work with FHIR. So what do you think your role or Smart Medical Services role is in some of the things that you mentioned, like bringing stakeholders together, or it was a very interesting one to me. So if you can answer that question, and then I invite you to pose a question to one of the other speakers. Still on mute, Amr.
First thing is we have to challenge ourselves. So what have we achieved? So one of the major things is that it's been 10 years, it's a very long time. And that's what I was saying. And when is time? What will FHIR make it on time? When is time? Because to challenge ourselves, I would ask myself, okay, so how many users are you using us? How many providers are? How many patients are we serving? All these KPIs, it's really difficult to challenge how much market share you have, and then move on to financial viability. In involving stakeholders, it takes a lot of time. So involving governments, donor money, different developmental organizations which are funding the FHIR project currently takes time, and it's a very complex problem. I still remain one of the major, and as Dr. Sikak was saying, the projects stop as soon as the funding stops. And at the end, I would say that our thing is, the way we would judge how we succeed or not is by how much market share do we have, how many more users are using our platforms, and then why are we going to change it completely to FHIR? We're not the largest player. So we are the largest players. I talk to them all the time, and it's always good to know what they're doing. And I would disagree with Dr. Austin that they don't know what FHIR is. Their chief technology officers don't know what FHIR is. And I'm talking providers, digital apps, payers. Even a lot of the government part is not in that direction. For them to be on that direction, they have to, first of all, understand it, and we need to engage them and make them understand why this is a good option versus the options they are being told to use. I would not consider that we have succeeded in the first conference I attended with you, Omar, in HL7 and with FHIR was more than 3 years ago. And I cannot claim that we have success. We tried, we spent a lot of time and effort and money on it. But again, it goes back to the resources, stakeholders, and financial viability. And this is the challenge which I challenged myself with it. And the question I would ask to my colleagues and to everyone listening is, so what have we actually done? Over the past 5 years, what have we said we're going to do? And what have we actually done? To be realistic, it's a reality check. And then we see what we've done wrong and what we've done right. But I think this is the only way for us to quantitatively say that FHIR will be successful in Africa or make it on time in Africa is by looking backwards and saying, 5 years ago, this was our plan. This is what we said we're going to do. What have we actually achieved? And why haven't we achieved it? And it goes back to the same thing. is there's not going to be a superstar who is going to manage to just debug everything. The stakeholders have to be there. No one from the donor organizations think on. If anyone from a donor organization representing an investor or a government organization, WHO, is attending this, because all of them look at Africa, it would be great if he'd let us know. We would definitely like to know his thoughts. So this is someone who is completely there. And then how many doctors are there? And then how many actual providers are there? Because patients won't care about FHIR. Patients just care about their health records. So this is the main thing, how would we start looking at that, quantifying? Because if we haven't collected that, then let's do this right now. We're going to say what each of us is going to do in the next 5 years, document that, and then talk again in 1, 2, 3, 4, 5 years and see where we've achieved.
That's an interesting take. And Dr. Akpakpan, you're not the only pessimist, it looks like. But does anyone have a response to that?
Well, so I mean, I would like to kind of add to that. So one question I would have is, as a person in the private sector trying to build out healthcare solutions, how far in the FHIR and interoperability journey have you gone? Have you started implementing FHIR into your solutions? I mean, are you thinking of it? Is it on your roadmap? And then given that, what challenges have you run into? Because I'm thinking in relation to the 10% completion rate, which I have a huge problem with when it comes to interoperability projects. So what are your perspectives on kind of why we're having this kind of high, very low completion rates with the use of FHIR? Dr. Okogun, if you want to take that, I'd like to hear your perspective.
Yeah, I'd actually love to also invite Graham if he's to get his take. But Dr. Okogun, please take it from here.
Well, like I said, thanks, Dr. Sika. Like I said earlier, the awareness about FHIR is very low. I myself, I got to hear about FHIR just about 2 months ago. But even in our software designs of the first and second version, we have always talked about information sharing. It's already been frustrating for you to know that when patients come to you, you cannot get information about them from the other places they've been to. So it's always a restart all the time. So being a provider and being somebody who's also trying to get involved in software development, from a sponsor standpoint, you wonder, how this could be solved. So coming to know about FHIR for me was a great, realization. And the thing is that we are lucky that we are at the early phase of our version 3 development. And so we're actually bringing this whole FHIR ideology into our development at this moment. And I think that if we spread, the message about FHIR, across Africa, among the developer community, even the user community for the softwares, it may stimulate a new thinking around it. And I think that is the starting point to any project, anything you want to do. There has to be an awareness about what it is. In a situation where the awareness is very low, you can actually say that the amount of the success is going to be very low as well. I mean, the penetration and the impact is going to be very low. And I see standards. It's important as people working in Africa who are aware of FHIR, we need to find ways, to spread this message, such that there can be a better uptake. And that may drive a new kind of thinking, a new kind of impact, a new kind of, developments, when it comes to software. Thank you very much.
Totally agree.
Sorry, guys. I see that Graham wants to say something. I just unmuted him.
Yeah, thanks for unmuting me. Someone asked about WHO. I thought I'd say that we're working with WHO on a number of projects that grow every few months. And the General Assembly appears likely to recommend to all of its member countries that they build a plan to adopt FHIR and to turn its possibilities into actualities. And we're still working with the team around what that recommendation might look like. So that's kind of a totally different perspective, but it's working towards that. But it's WHO, so you don't know how quickly it's going to happen or whether it will happen.
And Graham, do you have any insights into like this idea of low rates of completion of people that try to work with FHIR? We certainly, Dr. Seacock was sharing about 10% is the number that he saw, and like many numbers of resources and stuff.
Well, the first question I ask myself is that meaningfully different from the first world, you know, from the rich countries, from USA? I'm not, you know, I'd be really interested to know what the stats were on equivalent methodology, but it seems to me that the conditions in Africa encourage people who have a good idea to try something, but the wider infrastructure doesn't exist to take the idea home, and that's more pervasive than the problem in countries with more infrastructure. I might be wrong. I didn't want to say very much because I'm not in Africa, but those are the things I'll be asking myself about that.
Guys, I have to stop you because we're over time already. Maybe we can there's one other question, but I have to stop you. We are very strict about that. I want to thank you all for joining, and also the speakers. Thank you very much, Omar and Amar and Nikak and Austin. Maybe we can continue this discussion somewhere else at some other time.